be closed. For this Glasgow Coma scale, the minimum is 3 marks and the maximum is about to 15 marks. If there is no response also, we are not giving 0, we are saying it as 3. First, for eyes opening, if there is no response means we will give 1 mark. For eyes opening to pain, if we are touching or pinching or pricking the patient, then the patient's open his or her eyes, it comes under 0.2. If we are asking the patient to open his or her eyes, then the patient tries to open his or her eyes, it comes under the 3. The patient is normally orienting and opening his or her eyes continuously, if it comes under 4. Motor responses, if there is no response, it will comes under 1. If the patient obeys my command, it comes under 6. If he obeys my command, if I am pricking the elbow or pricking the biceps brachii, then the patient's localizing the pain and giving a command to flex his or her elbow, then it comes under localizing pain. If he withdraws for the pain, then it comes under 4. If his withdrawal is only about flexion only, it is abnormal, then it's for 3. If the withdrawal is for extension only, it is also comes under the abnormal and it scores under 2. If there is no response, it will comes under 1. For verbal response, oriented, if he is oriented, if he is fully oriented, it comes under mark 5. If he is not oriented and little bit confused, it is 4. If he is not using correct sentences but inappropriate words, means it comes under 3. If he is giving incomprehensible sounds, it comes under 2. If there is no response, it comes under 1. So if a patient in a coma stage with a minimum of 3 score is not able to do anything, he is a bedridden patient. We can conclude that. Then we go for a mini-mental state examination. For this mini-mental state examination, there are 10 scores for orientation. The item is coming like this. We are giving 10 marks to a patient for orientation. The particulars are this. For 1 mark for date, which date it is, which year it is, which month it is. We ask the patient to write the date with the month and year. It comes to 3 marks. And we'll ask about what day it is, what season it is. If they are saying now it is about winter season, what hospital, which floor you are, because the patient may know while coming, he should know for the first floor he is there, or for the with the second floor with the taking the lift he came to the second floor, like that he should say which city or town he is living, which country, which state he is living. For this we are giving 10 marks. Then for registration, for orientation, object 1, 2, 3. For name 3 objects, we are just saying that name any 3 objects in front of you. Then for attention we are giving 5 marks. For attention, begin with 100, count backwards by 7, and alternately we will stop a number and we will again ask the patient to continue. It is for attention and calculation. Then alternatively spell words backwards. If we can give any words and we can ask the patient to spell it backwards. For example, if it is a physio, OISYHP, it is the full word for physio. I spell it backwards. Likewise, we can ask the patient to spell it backwards. And then we can recall those 3 words or those 3 objects we first ask him to identify. Then language naming. We can ask the patient to name the objects. We can show a pencil, or we can show a watch, we can show a note, and ask him what is this. Repetition. 3 stages of performance. No ifs, ands, and buts. Without these words, we can ask the patient to repeat any 3 sentences. 3 commands you should obey. Take a paper in your hand, fold it in half, put it on the floor, Likewise, we are going to instruct the patient. If the patient takes the paper and put it in the floor, then he is not obeying our command. Then he is also